Blood collection. Following precautions are observed. Equipment. Use a clean syringe, needle and container. None should have any trace of alcohol. Nowadays, vacuum are used which are sterile glass or plastic tubes with a closure that is evacuated to create a vacuum inside the tube, facilitating automatic drawing of a predetermined volume of blood. They already contain anticoagulant and a preservative container. Screw capped glass bottle of universal size and not needed if vacuum are used. Cleaning skin. Do not use spirit. Use 1:1000 mercury chloride or plain soap and water. Use adequate preservative. After collection, sealing the container should be tightly clamped and sealed to prevent loss of alcohol by evaporation. Rubber stoppers should be avoided because they may contaminate the sample with oxidizable substances. In medico-legal cases, number of seals must be mentioned and a sample of seal must be along with the chain of custody labeling with the CR number, name, age, sex, date and time of collection of specimen. Send for analysis immediately. If cannot send immediately for some reason, refrigerate must not be frozen. Freezing causes cells to lysis, causing spurious concentration. Analysis should best to be done within a week. Inspection. Brown syrup poisoning causing rhabdomyolysis, myoglobin release. Chocolate color methemoglobinemia. Pink serum hemolysis, sodium chloride poisoning. Breath. Advantages simply non-invasive, can detect a very vast variety of compounds. Approximately 200 compounds have been detected in the breath of a normal human subject. Closely reflect the arterial concentration of poison and may obviate the collection of arterial blood sample, which is much more difficult. Particularly, the advantages where repeated arterial blood samples are required in monitoring a patient. Breath is a much less complicated mixture than serum and urine, as is amenable to complete analysis of all the compounds present. No workup of a breath sample is required, in contrast to many analyses performed on serum or urine sample. Provides a direct information on respiratory function that is not obtainable by other means. Dynamic real-time monitoring of the decay of volatile toxic substance in the body is straightforward by MS technique, especially useful in alcohol and asphyxiant poison. Limitation: only volatile small molecular mass compounds are accessible. Some compounds of larger molecular mass that have been detected in breath are tetrahydrocannabinol, 1,3-butanol, 3-methyl benzoate, and heptadecanol. Standardization of breath samples collection is more difficult than for serum. Rigorous standardization occurs if valid quality results are obtained. Instrumentation for breath analysis is also expensive. Simple chemical test widely used in serum and urine analysis for an inadequate for breath analysis. Collection of breath sample. A standardized reproducible breath sample is medically important for quantitative breath analysis. Otherwise, the proportion of alveolar air and dead space air will vary between different breath samples, leading to high variable, degree unacceptable data. Usually, acceptable method is rinsing out of the dead space of the lungs by 3 to 4 breath, then collect the later half of an expired breath. Thank you.